This morning I'm here with Michelle Lee. Hi Michelle, how are you?
Hi, I'm good, thank you. Are you?
Good, thank you. Michelle has been working with us at Physiopedia to develop the pain course, which starts this week. So we're going to just have a chat to Michelle about what she's been preparing for us and what we'll be expecting to take part in over the next 4 weeks on the pain course. So Michelle, do you want to just give us a little overview of what everyone can expect to do over the next 4 weeks on this pain course?
Yeah, so the course will run over 4 weeks, and it's basically looking at persistent pain and understanding pain. It's quite a big topic, really, so we've split it up into 4 sections to try and make it a little bit easier to digest. So in week 1, we're going to be looking at what pain is and looking at the neuroanatomy and physiology as a foundation, really. And so then we can build on it and kind of progress through the weeks. In week 1, we've got an expert, Tasha Staunton. She's from the Body and Mind group in Australia, so she gives us quite a nice overview of what pain is, really. Week 2, we'll move on to the psychology of pain and pain in the brain. And again, we've got another expert in that to have a chat to, which will be good. And each week really we've got some reading to do and some discussions, and there's a little quiz in week 1 as well for you to have a go at, which is based on all the content that we've written and gathered for you. And then week 3 we're going to move on to looking at the assessment and outcome measures that we use. And that week will be there's another little challenge in there for you to have a go at. There's doing some literature searching and finding some of your own information, which is a really good skill to try and develop. And then the final week we'll look at the treatment and the rehabbing pain, people in persistent pain, and look at some different ways to try and manage it. And again, we've got another expert, which is Peter Moore. He initially was a patient, so that'll be an interesting interview to have a little look at. So that's a bit of an overview of the course, really.
Good. It sounds like a really interesting course. I think it'll give everyone a really good covering the basics, give everyone a really good understanding of pain so that they can spend 4 weeks learning this knowledge and then take it on to develop further knowledge if they want to on pain. I think it'll be a really good groundwork course for pain. Have you got any tips for week 1 in particular this week?
So obviously there's a little bit of reading to do, which is probably not the most exciting part, but we've tried to mix it up a little bit and put some videos in there, and we've obviously got the video with Tasha as well, which is interesting. And I'd really kind of encourage people to take their information. If they read something, maybe pop another question in the discussion forum, or just have a chat with people. There's people from all over the world, really, and different experiences. So I'd utilise the discussion forum as much as you can, really.
Yeah, definitely. I think the discussion forums it's not just about answering the questions that we pose to people, to you. It's really about, this is an opportunity for everyone to talk to everyone around the world, like Michelle says, and I think you really need to make the most of that opportunity. So don't think of the discussion forum as having to answer a question. Think of it as a place to discuss with your colleagues, ask questions, answer questions that other people say, and get a discussion going. Imagine that we're all in a group, in a room, in a course face-to-face, and this is what's replacing that discussion. So yeah, try and use the discussion forums to really gain knowledge from other people and learn from other people. I think that's a really good piece of advice, Michelle. Okay, so week 1 this week, we'll starting now. We'll have fun, everyone, and we'll chat to Michelle again in week 2.
Great, and we'll see you in the discussion forums.
Thanks, Michelle.
Bye.